So pregnancy and childbirth are definite known contributors to increasing our risk of experiencing pelvic floor dysfunction or challenges like incontinence and prolapse, chronic low back pain. And part of it is
All right. Well, I am so happy to be able to welcome one of my own to the podcast today. This is Kim Vopni. Kim, welcome to the show.
thank you. Excited to be here and chat with you.
Yeah, and we are recording this live inside the Hello Betty membership, which, for those of you that are not familiar with it, it is my female-centric membership on all things nutrition and fitness. We talk about vaginas, we talk about hormones, we talk about sex, we talk about all the juicy conversations that you maybe wish you had when you were earlier, younger, with friends, but never had the opportunity to. And when I saw that Kim was one of our Bettys in our membership, I really wanted to highlight you because you are not only a Betty, but you are, of course, a pelvic floor specialist. And this is a big topic inside Hello Betty. I did a training on this last month, and there was a lot of interest. And so I'm really excited to be discussing all things pelvic floor with you today.
Well, I'm excited that you're chatting about it too, because of course I'm biased, but I love the pelvic floor, and I will welcome anybody who will allow me to share some information and help spread the word, because it really is a sort of it still is a bit of a taboo topic, and not a lot of people are yet aware of all they need to know. So I really am thankful for you highlighting it.
Yeah, and it's a topic that sort of reminds me of menstrual cycles. So as you may or may not know, I wrote a book on, living in alignment with our cycles, and it almost seemed a bit taboo to talk about bleed week. And you're bleed.
Yep.
Yes, we bleed for 5 days out of the month, and I feel like there's a similar through line there with pelvic floor, the discussion around pelvic floor, and even when I was back in physical practice, I would refer patients to PT, physical therapists all the time who had specialized training, like pelvic floor physiotherapists. And they would be like, you know what, it was just weird. Like, I just felt like I was getting like, there was, they didn't like the experience. And I think that there seems to be this, I don't want to say subculture or counterculture, but almost this uprising from women saying, you know what? We're not little men. We have different needs. We go through things like childbirth. We bleed every month for, a certain amount of years. And I'm sick and tired of being ashamed of it. And I'm sick and tired of feeling guilty and like there's something wrong with me. And like I need to know more about, my yoni, as some people refer to, or my nether regions, whatever it is. So yeah, I'm glad you're here too. So let's before we and I want to ask you about your history. I want to ask you about how you became, because you're known online as the vagina coach, which is just the best name ever. Your handle on Instagram, the vagina coach, all these things. But before we get into that, just for my ladies and the other humans who love them, let's just define what we're talking about, because even still today in 2021, the pelvic floor, like, it's like, what is that? Is that the area that you Kegel? Like, let's talk about, what the pelvic floor is, where it is, and its function, its mechanical and, physiological function.
Yeah. Yeah. Yeah, you're right. And there's all sorts of names. And I like to start out talking with the proper anatomical terms, and I encourage anybody who's a parent to use those with their kids. But at the same time, I appreciate that we want to have a little bit of fun, and it can sometimes be a difficult topic to talk about. And if we add in a little bit of slang words here and there, it can sometimes increase the comfort of some people talking about it. But so the pelvic floor is a group of muscles that close off the base of our pelvis. So within our pelvis, we have bones, and we have a bunch of nerves. We have lots of blood supply. We've got this group of muscles that attach from the pubic joint. So at the front, people call it pubic bone sometimes, but it is actually a joint at the front. And at the back, we have at the end of our spine, the very end, our little tail. People call it the tailbone. It's called the coccyx, if you want the fancy word. That's also an attachment point of the pelvic floor muscles. And then if we're sitting in a chair And if we kind of put one hand under a butt cheek and we pull the flesh of our bum away, we should be able to kind of dig our fingers in and feel a little bit of a bony point under each butt cheek or within each butt cheek. And that would be the ischial tuberosities or sits bones. And so those 4 points make it's almost like a diamond shape. And those are where the pelvic floor muscles attach. And the important part is, as you mentioned, some people call it the Kegel muscle. And it's important to understand that it's not just one muscle, it is a group. There's 3 layers. And the first 2 layers are primarily responsible for closing openings. So within the female body, we've got our anus, we have our vagina, we have our urethra, and the pelvic floor plays a role in helping those open when they need to and keep them closed when we don't want things to be coming out. And then we have the 3rd layer that's primarily responsible for organ support. So in the female body, we've got bladder, uterus, and rectum. And the pelvic floor muscles play a role in helping keep those organs supported and in their proper anatomical position. The pelvic floor also plays a role in our pelvic and spinal control and stability. So because of the attachment points on the spine and the pelvis, it plays a role in our core control mechanisms. And it plays a role in our sexual response. And it also has a bit of a sump pump action. So the pelvic floor actually moves in coordination with our breath and creates this sort of, as I said, sump pump to help move things, to help with digestion, circulation, getting toxins out. So it's these really, really important jobs that we're never told about. And if we knew the importance of this part of our body, I think it would open up conversations earlier. It would help decrease the shame. And it would also help prevent a lot of these challenges that people deal with. And a lot of them they deal with in silence. They suffer with in silence because it's this taboo subject, and it's often associated with shame or trauma or embarrassment. And people sometimes are dismissed by healthcare providers like, oh, it's just part of being a woman, or it's because you're reaching menopause, or it's because you've given birth. And even media tells us that light bladder leakage is just part of being a woman. So we're fed all these messages, and even through our families, maybe passed down through generations, that, well, that's just what happens. But thankfully, with social media and a whole bunch of pelvic health preachers like myself, the conversation is getting out there, and people are now recognizing that there is a lot that can be done. It's not something they need to accept as something they need to live with for the rest of their life. And they're starting to place value at this part of the body that is the foundation of our core and really is the source of our confidence and our power. And when it's optimized, we move better, we sleep better, we can enjoy sex more. It just influences so many parts of our life.
Absolutely. And I have to say, this would often come up in clinical practice where when we were trying to get, and it would never come up in the beginning, right? It would always, I would have a patient presenting with, persistent low back pain or knee issues or thoracic dysfunction. And you would go through some of the, things that as you accrue over the course of time, you sort of accrue tools that that are going to work and that are robust in terms of their efficacy. And there would be those patients that you do all the things and then, it would still be happening. And it would only come up after you sort of develop a certain amount of rapport with the woman. And then she would end up saying, you know what, like, I can't, like, I remember it was, there's one patient I'm thinking of in particular, and she's like, I can't go to the trampoline park anymore with my kids. Like that was, and I was like, why not? She's like, oh, because like if I don't have I will have to bring a pad with me, or if I don't, like I'll pee, there'll be some leakage. And so then I was, sort of became savvy to, these people who didn't get better with just a low back intervention or just a glute intervention or just a thoracic expansion intervention or whatever it was that I was doing, that I would start asking them about these questions. And I'm like, and then, when you ask it, they're like, how did you know? Like, did something happen? It's like, no, it's just, just from clinical experience, like this is kind of what happens. And I think it's so important that we're talking about this because, if you are a woman, as you said, if you're a woman who just accepts this as part of getting older, like I just need to wear a pad because I'm 50 or I'm 60 years old, like pardon my French, but fuck that. Like that is not an appropriate model for most women to adopt. Now there are extreme, we'll get into pelvic organ prolapse, and we'll talk about some of these more extreme cases where we have this dysfunction, where we have, or, the viscera,
Yep.
extrude, like coming out of the body, will get there. But for a woman, you should be able to run, you should be able to laugh or cough or sneeze, all of these things that increase, intra-abdominal pressure without leaking.
Yep.
Yeah.
Yep. Yeah,
Okay.
1000%. And just, I wanted to touch on something you said with regards to back pain. There's a researcher out of Milton, Ontario, Dr. Sinead Dufour, who did a study that was recently published. And she was looking at the correlation between low back pain and pelvic floor dysfunction. And in her study, and it was all women, 95.3, I believe was the number, percent of the women in that study who presented with low back pain also had some form of pelvic floor dysfunction, typically incontinence or prolapse. So the two are very closely tied. And so many people experience low back pain and they'll see a chiropractor or a massage therapist or maybe acupuncture, maybe physio. But pelvic floor physio is not many people know about it. And that can often be, as you were talking about, that can be the missing link for so many people.
Yeah. Well said. All right, let's talk a little bit. So one of the most common, in a woman's history, if I was looking for any evidence of pelvic floor dysfunction, it was either, one pregnancy or she was multiparous, meaning she had more than one. So pregnancy and childbirth. So let's talk a little bit about some of the mechanical changes that can happen, some of the increased pressure, the shifting in weight, the spine, like let's talk about all of those things as it relates to the pelvic floor in pregnancy, and then what we can expect postpartum after childbirth.
Yeah. So pregnancy and childbirth are definite known contributors to increasing our risk of experiencing pelvic floor dysfunction or challenges like incontinence and prolapse, chronic low back pain. And part of it is biomechanically. So our posture changes. As a result, we have increased size, most people, in their breasts. Sometimes we get more rounded in our shoulders. In our abdominal wall, obviously the belly starts to grow out in front of us. We have the 2 six-pack muscles in the abdominal wall. Those are our outermost abdominals. Those are joined, like held in place at the midline by a connective tissue called the linea alba. And that linea alba faces stretch as the belly grows. And sometimes the rectus will move away from the midline. So that can alter our core control mechanisms. Also, the underlying abdominal muscles are also experiencing stretch and sort of displacement, I guess is a word we could use. Our center of gravity shifts. So now the way that we start to hold that weight. So sometimes it's very common to see pregnant people that are waddling, and they often have their upper back is sort of leaning back and their pelvis is almost thrust forward, and they sort of do this little waddle. Sometimes it's because of discomfort and pain, and sometimes it's because that's the position that they have adopted to almost counteract this center of gravity, this growing belly that's out in front of them. And that can then result in altered breathing mechanics. It can create more discomfort in the low back. We even have research to say that pregnant women have more back pain than non-pregnant women. And I don't know if we necessarily needed a study to confirm that, but it's true in other reviews.
Yes. Yeah.
So, and then the muscles, the pelvic floor muscles, those alterations in how we're carrying our weight also alters the way that our pelvic floor muscles are functioning. And oftentimes they start to hold on to more tension. So part of it is because of the relationship between the diaphragm and the pelvic floor starts to shift a bit because of that change in our posture. Sometimes it's because maybe we're sitting more or sitting in different ways because we're trying to manage pain. But those are the most common. We also experience the hormonal fluctuations that can contribute to some discomfort, pregnancy aches and pains, most specifically in the pelvis and in the in the low back. So pelvic girdle pain, pregnancy-related pelvic girdle pain, especially in the pubic joint at the front, the tailbone, and also the SI joints in the pelvis. So SI joints here at the back, we have 2 of them. We can have tailbone pain down here, and we can also experience pubic joint pain at the front, partly because of the hormones, but then also we have an additional weight. So we are carrying this ever increasing load as the baby grows, potentially babies, that's not only shifted our center of gravity, but the muscles need to carry that load as well. And if they're not in their ideal optimal position, then other muscles will maybe start to overwork. So sometimes the posterior pelvic floor starts to come in a little bit more, but then also the glutes start to become a little bit inhibited. So you see in pregnancy, it's not as, I guess, visual, partly because we typically carry a little bit of excess weight. But once people have given birth and the weight starts to come off the body, if you look at the back sides, like the butts of new moms, they're often very flat and sort of tucked under. And part of that is because their body has adapted to that shifting center of gravity. And then once the baby's born, they don't just let go. The body has adapted to that new state. And there's often a lot of tension in that pelvic floor, which we want to address when we're pregnant because that can hinder us during our birth. And we want to make sure that we address it afterwards because that's a contributing factor to the lingering things like incontinence and prolapse.
Yeah, and that's such an important point that you bring up. I often find myself shouting from the rooftops the importance of butts, the importance of a Betty booty,
Yeah.
because when you and I call it the Betty booty. It's like branding and whatever, it's fun, but really, as a chiropractor, we've talked about this idea. We call it. I think there's some overlap with physiotherapy as well, where we refer to this as lower cross syndrome,
Yeah.
or glute amnesia is how it sort of was originally referred to, where the glutes are, as you mentioned, inhibited. And then it's hard to actually reactivate that neuromuscular connection. Hence what you are, when you, observationally say, okay, like there's a flattening of the roundness of the glute maximus. And then the way that I had the pregnancy waddle too. Like I remember feeling my first son engaged, like when he had sort of descended, and like I couldn't bring my legs together if I tried. Like his head was like in the ring of my back. Like
Yeah.
I was doing the waddle too, right? Like we all go through this as women, but then there's so much conflicting. First of all, we're never taught like what you just said,
Yeah.
and the way that you just said it. We are not often explained that. So I would give lectures in the clinic. I had a big pregnancy population, a lot of new families where I was practicing. So we were talking about the mechanical changes in the spine, and the center of gravity shifts forward. And then you get these, and the kyphotic, like the accentuation of the kyphotic curve, the accentuation of the lordotic curve, the changes, as you mentioned, the sacroiliac joints, as well. One of the things we'll get to childbirth in a minute, but I wanted to touch on, I want to talk a lot about Kegels, but specifically, I want to talk about the controversy of Kegels during pregnancy.
Yeah.
So when I was becoming certified in, I was taking extra training in pediatrics and pregnancy. One of the things that we were taught. Now, this is, like I said, I sometimes I feel like I'm 5 centuries old. So when when we were first learning, we were taught that, well, if you do Kegels while you're pregnant, you mentioned the attachments of the pelvic floor, one of them being the coccyx posteriorly. So if you are too aggressively doing Kegels while you're pregnant, you can now bring the coccyx, which is the tailbone, anteriorly, which can now interfere. Let's say you're on your back giving birth, then you can push the coccyx such that it starts to interfere with the baby's ability to pass through the birth canal.
Yeah.
Now, I have thoughts on that, but before I serve up those thoughts, I would love for you, I would love for you to first, do you agree with that? And my question, I might have asked it a little bit preemptively, because I think there's when we talk about a Kegel, there's sort of two important parts to it. But first I'll ask, do you agree with the premise that a pregnant woman should stay away from Kegels? If yes, why? If no, why not?
I don't agree. I believe that there is a place for Kegels. And my approach for anybody doing Kegels, regardless of whether they're pregnant or not, they need to be done correctly. They need to be done consistently and ideally coordinated with movement. In pregnancy, there's a shift where I may, depending on the person, have them reduce the number of actual contract and lifts versus how many kind of relaxations they may do. But there's benefit in taking the muscle through the full range of motion. With any part of our body, our muscles like to go through their full excursion. And by limiting that, I don't think it serves the purpose fully, or just focusing on the relaxation. I think there's benefit in doing both. But there's also a slight shift that I have people do around the time that they would start perineal massage, which is usually somewhere between 35 and 37 weeks of pregnancy. And that is, the focus becomes, I guess, solely on relaxation, learning to surrender, and ideally done in conjunction with perineal massage, where we're introducing discomfort and stretch and pressure. So sensations that they will be experiencing while they're birthing, and learning how to yield, learning how to surrender, learning how to release tension, even if you're feeling some discomfort. Because usually discomfort makes us withdraw and kind of tighten up. And their birth is not comfortable. And we have to learn how to surrender into that. So I believe that if we can train the pelvic floor in positions that mimic what we're going to be experiencing in labor and birth, and then I do believe in perineal massage and coordinating that with breath and relaxation, then we're training the pelvic floor to be responsive to the task at hand, to what we're going to be experiencing. So I believe that there is a place for Kegels in pregnancy.
Yeah, and I agree with you, because I think that when we think about, these are, when we think about the pelvic floor, these are skeletal muscles, right? So we need to be working the concentric and the eccentric, or, in this case, as you mentioned, it's tension and release. And I think that what happens whenever we think about muscles, we often will think about the contraction. We think about the contraction, the concentric versus the eccentric. And I remember learning, and this is not even just pelvic floor related. Like when you're in the gym, and you're watching someone do like a bicep curl, the way that we even count, it's like we count on the concentric. It's like 1, 2, but if you look at, even if you go to sort of Eastern Europe, and the way that they train, they actually they count on the eccentric. So they'll come up and then they'll slow that eccentric down. And then that's count 1.
Yeah.
And so I think there's a tendency in North American Western culture to really be thinking about tension more, add more weight, and then add more weight again. And then we actually forget about the power, pardon me, we actually forget about the power of the eccentric.
Yeah.
And in this case, it's the letting go, it's the release, it's the opening.
Yeah, exactly. And that's how we need that release to be able to generate power. And what's happened with the Kegel exercise is people have thought of it as just a squeeze. And so they're often squeezing, or, squeezing and holding. And sometimes they may be squeezing their pelvic floor, but sometimes they may be using their inner thighs, or they may be using their glute muscles thinking they're doing a pelvic floor exercise. And when the focus is solely on just squeezing and holding tension without relaxation, then I always equate it to like a bicep curl. So here's my arm extended out, and pretend it was down at the side of my body, but that's the resting length of my arm. And from here, I have a full range of motion for my arm to move through. And if I was to walk around with it half bent all day long, maybe even carrying something on there, then when I was called upon to do more work, I would say, well, heck, I've been working all day. I'm kind of tired and I don't have much room left. So there's not really much power left here anyway. But if we learn how to relax and let go and come back down to that optimal resting length, and train the pelvic floor to go through its full range of motion, then we have more capacity for power, and we can respond to those increases in intra-abdominal pressure that we were talking about earlier. So, and the pelvic floor, as I mentioned, there's a closure. So the first 2 layers are responsible primarily for closing openings. And then the third layer is primarily responsible for organ support. And that's a lift. Levator ani is one of the groups of muscles, and that means lift the anus. And so we have to remember, it's not just a squeeze, there's a drawing up, and then there's the let go. So there's kind of 3 parts to a Kegel: contract, lift, and let go.
And I think there's so much confusion because, the technocrats, the technocratic, totalitarianism that we live in, you could search up how to do a bicep curl. You could look and say, oh, I see that's how and I see he's supinating the forearm now. Now he's pronating the forearm. And there's all these different ways that you can do the bicep curl. But you're going to talk to us a little bit about how to do a Kegel, but, as much as, I think we wouldn't be able to film you doing, like, we wouldn't be able to kind of get under and like take a look at what's going on, right? So we have to use our imagination, because we don't necessarily have those visual cues that we can see on a YouTube or on an Instagram or on a whatever, to
Yeah.
be able to see what's going on. And I think that that's where, I've often heard, like, pretend like you're zipping up your trousers, or pretend like you're like, it's kind of this like zip and lift, or like you're holding in your urine, like that sort of visual cue. But for some people, when you're just using words and you can't demonstrate,
Yeah.
and that maybe that's where the value of a pelvic floor physio comes in, because they can actually coach you, like their fingers are there, and it's like, okay, I need you to lift more here, I need you to put pressure there, I need you to relax it, all of that
Yeah.
as well.
And I think, like, yes, to me, I'm always preaching pelvic health physio, and I believe that is our gold standard. And if you have access to one, I view them kind of like the dentists of our pelvic floor. So we have been conditioned from a young age to brush our teeth twice a day, floss, go to the dentist once or twice a year. Even if we have no toothache, no symptoms of anything, we just go to have a checkup.
They're
And if we have
brilliant
that,
marketers, aren't they, those
if
dentists?
we have
Like,
the same press for our pelvic
right.
floor, we were taught at a young age that this is an incredibly important part of our body. This is how you do pelvic floor exercise. And then once you become sexually active, go see these amazing practitioners and they'll help keep it in check for your life. That would be transformative. And so the other piece to that is not everybody has access to a pelvic floor physio, and we have our own biofeedback. We have our own fingers. We might even have a partner. And if we have a partner, they have fingers, and it's a male partner, they have a penis, and those can be biofeedback. So we can explore our own body and feel, like when I do a Kegel, so I'll walk you through some cues, but can I feel like there's a gentle hug? Can I feel like there's a gentle drawing up? And can I let that go? And you can ask your partner, can you feel when I do this? So yes, pelvic floor physio is what I always recommend as our gold standard, but we have access to tools. And if you're not comfortable with your fingers, there are biofeedback products even that can help you.
Oh, I see them now. They always are,
They're all over the
advertising
place.
on Instagram. Like, I'm like, oh gosh, what do you guys, I always get it's like the ones where you squeeze and it sends it sends a thing to your app about how much, like how many newtons of force or whatever.
Yeah.
Yeah, they're very cool. All right, let's talk a little bit about, well, actually, first, before we get there, what is a perineal massage? Just for like you mentioned it before, I'm familiar with it, but just for my Betties who have never heard of what this is this something just localized in the context of pregnancy, or is this something that we can also use as a therapeutic intervention outside of pregnancy?
It's typically associated with birth preparation. So the main philosophy around perineal massage is to prevent tearing. So that's what it's promoted for. I view it as a way to introduce sensations of stretch, pressure, and discomfort. And that person who is either doing it on themselves or having somebody do it for them then experiences those sensations and learns what they need to do in their body to relax and to release and to surrender. So some people say it's like stretching, pre-stretching the muscles, yeah, or the tissue maybe. But part of what can contribute to the increased chances of tearing are tension. And if we can learn how to release and relax those muscles, that's very powerful in terms of reducing the likelihood of tearing. So from a landmark perspective, the perineum is in between the anus and this is the vulva. So this is the perineal body here. And it's very common to experience tearing, usually off to the sides. There are some people who do experience some tearing upwards, but it's typically in through the perineal body. And it used to be common for doctors to perform what was called an episiotomy, where they would actually cut this tissue. And the intention was, by cutting it, it would create more space and therefore make it easier for bum and babe. But what was happening was that was leading to more significant tearing and potentially tearing even into the anal sphincter, which was creating huge issues for people.
And
So
not the way a woman might necessarily tear at all.
exactly. Yeah.
Yeah.
So natural tearing is definitely preferred over an episiotomy. Now, episiotomies may be performed in an emergency situation, but thankfully not done commonly or like routinely anymore. But it's very common. I mean, I think the statistic is over 80% of people will have some degree of tearing, and first and second degree is fairly superficial. It's the third and fourth degree tears that we're trying to avoid. And those are the ones that can have more long lasting issues. So the point of perineal massage is really to help, again, introduce those sensations, learn how to surrender. And there are studies to support that people who participate in perineal massage may have a higher rate of intact perineum versus those that don't. But people who have torn potentially, or have maybe had a pelvic surgery where there was a repair to the perineum, or they had to cut the perineum in order to to perform the surgery, that leaves scar tissue. And sometimes perineal massage can also be done to mobilize that scar tissue. And that can be done by yourself. And it can also be done by a pelvic floor physiotherapist.
Great. Okay, so let's imagine now that we've given birth, and I will also say that my experience postpartum was different than probably most, because I was under the care of midwives. So my postpartum experience was, I almost want to call it like delightful, because I had, midwives, kind of like, and shout out to the seventh generation midwives in Toronto. You guys are the best. You saved my ass, but they came to the house, like came to the house and weighed the baby and did all the tests. And like, I am such a type A. I had read all the books on breastfeeding. And when it came to doing it, I had no clue what I was doing. Help me breastfeed, all the things. But I understand that most people don't have that experience, and they might be under the care of an OBGYN. And the problem that I have with postpartum care with OBs is that, and I say this with love in my heart for all of my friends who are OBGYNs who are just following standard practice, is that, they kind of book a 6-week, follow up after the baby's born. And maybe there's an exam, maybe there's like a, how you doing? How's it going? And what's going, and then you're dismissed. And if you think about the length of a pregnancy, it's about 40 weeks, give or take 2 weeks, or give or take, 2 weeks on either side, for most people. And 6 weeks postpartum, 6 weeks versus 40, that's 15%, right? So you see the patient, after they've had one of the biggest events of their life,
Mhm.
and they're discharged, and they're like, okay, you're good. Like, see you in 2 years when you're pregnant again, or, or never,
Yep.
quarter to never. And I struggle with this as a standard of care, because I think that there's a lot of assumptions that can be left to the decision of the woman, who may not necessarily know that she may have some pelvic floor dysfunction. And at 6 weeks, like, God, some women are still bleeding, like you were still bleeding at that point. Right. So I'd love for you to comment on postpartum care, what your, ideal might be, and what we need to be considering. Like, if you if you are under the care of an OBGYN and they have said, hey, you're good, go back to everything. And then that woman's like, great, I guess I can go back to my boot camp classes now. And I guess I can go and lift heavy weights the way I was doing. And I guess I can, run marathons the way I was doing. Like, talk to me about what your ideal standard of care might look like, and why, and how that contrasts with the 6-week post-op or postpartum.
Yeah. My ideals are to take inspiration from cultures around the world that embrace the philosophy of mother roasting or mother warming. And these practices honor the need for the birthing women to heal and to recover. And that what you do in those first 40 days postpartum will set you up for the next 40 years. And the belief is that the body has gone through a transformation. The body has opened to allow a babe, to allow conception. The muscles in the midline have moved away from the midline to create space as the babe grows. The muscles in the pelvic floor have stretched and expanded to allow for vaginal birth. Maybe there's been a cesarean birth, so there's been incisions into the abdominal wall. So there's been this opening. And that leaves, in Chinese medicine, they say it leaves the body prone to wind or cold. And so they introduce wrapping, so wrapping the pelvis and the abdominal wall, warm massages with oils, warm nourishing foods, bone broths, collagen-rich foods. So there's a holistic view to healing the body. And in North America, many people are back at the gym at 2 weeks postpartum, and they're lifting weights. They're kind of, they like, I feel fine. And while people may feel fine, we have to appreciate all of the adaptations that have happened over the period of 9 months coupled with all that has happened, whether it's been a vaginal or a cesarean birth, and how that has altered the mechanics of our breath, the mechanics of our core control mechanisms, our ability to manage pressures. And that they're like, this is a very strong word, and not everybody will agree with me, but even if you have no external tearing, you have an intact perineum, there is still an element of injury that happens to the body in birth. And with any other injury, we would acknowledge that, and we would rest, and we would go through a period of gradual progressive movement back to an activity. When it comes to postpartum,
We'd
we
rehab it. We'd rehab it. Yeah.
we should be
Yeah.
rehabbing, we should
Yeah.
be retraining, but
Yeah.
we are given this elusive 6-week green light. We're sure some superficial tissue healing may have occurred, but we have some studies that looked at both cesarean and vaginal births. The majority of women have some degree of organ prolapse, so the displacement of the bladder, the uterus, and or the rectum at 6 weeks postpartum, the majority. And if anybody has experienced any form of incontinence while they're pregnant and have not addressed it, the chances of that lingering right after and even like for years beyond is very high as well. And if we took the time to rest and to recover and to retrain, so get that reconnection back between the brain and the pelvic floor, the diaphragm and the pelvic floor, and gradually rebuild that connection, rebuild the strength, stamina, endurance, suppleness of our core, and then gradually load it, and not by 6 weeks, like, see a pelvic floor physio around 6 or 8 weeks, and then we start to gradually add more loaded exercise. But my opinion is holding off on the higher impact, so running, jumping, really heavy lifting for around 4 to 6 months postpartum. That doesn't mean we're not doing anything. That means we are doing very intentional core restoration work, gradually loading, getting back to a 4 to 6 week timeline, and then making sure that we have met prerequisite exercises that say, yes, you are ready to go back to running without putting yourself at risk for injury or long-term core challenges like organ prolapse or incontinence. So I disagree with the 6-week green light. I think that, as you were mentioning, we have a 9-month period of adaptation. It's not unrealistic to think we have a 9 months on the other side of not an undoing, but as a rebuilding. And if we honored that, if we acknowledge that, I feel like the number of people who, I just had a person the other day who had a fantastic birth, no tearing, everything was lovely. I felt fantastic. And at 4 months postpartum, I was just moving a mattress with my husband and I felt a pop, and she developed organ prolapse. She had done no core restoration training. She had done nothing, like, and not to her fault. Nobody had explained that to her. She just simply didn't know. And I think there are so many people that say, why didn't somebody tell me? I wish someone had told me. I would have done things differently. And
Right.
and that just breaks my heart. It really breaks my heart.
And it's kind of, it also feeds into this, like, I don't know what they call it, but like, getting your body back. Like it's the baby, it's like your post baby body. That's what it is. It's like, you always see it in these like trash magazines where it's like, look, she gave birth like 2 months ago and she already has her abs back. And like, we feed into this, like, we don't honor what happened. It's like, we just want to forget about it as quickly as possible. Like I know you are Canadian. I am also in Canada. But a lot of Americans listen to this podcast. Actually, most of, my audience is mostly our cousins to the South, and they go back to work after 4 to 6. It's like it didn't happen. It's just like pop the baby out and back to work as per normal.
Yeah.
And I think that, I don't want to kind of, I talk a lot about the patriarchy. I talk about that on the podcast. But I think that this is part of it. I think that I really do. You are, as a woman, you are gifted and blessed with this ability to create life. And you do that by pushing this baby through your pelvis. And for you not to honor that, if you had a shoulder issue and you came to me, there would be a whole thing, like there would be a whole, like, let's work on passive range of motion, and then we'll get to active range of motion, and then we'll get to load bearing activity. I'm talking about this in like a rehabilitative sense. And let's make sure your proprioception is there. And let's make sure all of these different things going into the joint. And this is a multi-joint, it is the base of our bodies. And for you to just be like, yeah, I'm just going to run that marathon again. I'm going to, I think that is such a disservice to the
Yeah.
female form.
I couldn't agree more. And I look at, in pregnancy, that the belly is revered, and people are posting images every day and comparing it to the size of fruits and vegetables. We're so proud of it. And as soon as we've given birth, it becomes a place of shame, and we have to hide it away, and we have to look not
Correct.
pregnant as fast as possible. And
Correct.
I believe that's contributing again to the breakdown of the body. It's like, we need to rest, we need to recover, and rehab. It really truly requires rehab. Like any other part of the body that became injured, we would go through a rehab, and it is simply overlooked with pregnancy and birth. And there's also debate within the fitness realm, some physiotherapists as well, about how quickly we start to load. And there are some people saying, well, maybe we need to load sooner. And I disagree. I think we need to have that gradual return. And we are very strong, we are capable, we are very resilient, we have the capacity to do a lot of things. But for the people who aren't given that information, aren't taken through that gradual progression, and go back too quickly too soon, I don't understand the purpose behind it. We can gradually load, and we have seen the benefits of that through years of rehab and all different, in chiro and physio. And if we take those principles and honor them, then I feel like it would serve us so much better.
Yeah. Talk a little bit about, or if you can talk a little bit about how the pelvic floor changes. So you mentioned in the context of pregnancy, we can all, understand that there are hormonal changes, obviously wildly fluctuating hormonal changes, pre, during, and post pregnancy. As a woman is in perimenopause, let's say she has her, maybe she has one or two children, and then into menopause. How do some of the hormonal changes there speak to or influence the integrity of the pelvic floor?
Mm-hmm. So during perimenopause, which is, people will say it's usually the 6 to 10 years prior to menopause, and menopause being one day, that one day marks 12 months, consecutive months without a period. So you have menopause is one day, anything prior is peri, anything after is post. And the perimenopausal years there's a lot of stuff happening, and a lot of hormone imbalance. There's thyroid stuff. There's a whole bunch of things that can influence the person: stress levels, sleep levels, hormone levels, all sorts of things. And with regards to the pelvic floor, that person may have been experiencing some symptoms. So even people who have never been pregnant, never given birth, they can experience things like incontinence, and sometimes that can be posture related. Sometimes it can be hormone related. And in perimenopause, it may start to show up. And then once we get closer to menopause, then in perimenopause, our hormones are fluctuating quite dramatically. And once we reach menopause, then essentially our estrogen has been depleting and then essentially stops. So we are no longer producing estrogen. And within our pelvis, the walls of the vagina, with the tissues around our bladder, like within our pelvis, we have a lot of estrogenic tissue that loves estrogen. And when we no longer produce it, then those tissues become less supple. They may become a bit more dry, brittle. Vaginal atrophy is a term that's used. Vaginal dryness starts to show up. And it will pretty much happen to every single person. Vaginal dryness is, I'm not going to say everybody, but pretty much everybody. like there are going to be a few people here and there, but generally most people will experience dryness, and it's one of the symptoms that does not improve. So hot flashes may show up, but then they gradually, for most people, will start to disappear. But vaginal dryness does not typically improve. So that's one. Dryness is a big one. And also with the fluctuating levels of estrogen, even prior to, so within perimenopause, we may start to, a lot of people will comment how the week before their period or the week of their period, they will notice that they're more symptomatic. So maybe they're prolapse, they feel it more, or maybe they leak a little bit more. And that's very closely tied to what's happening with the the decline in estrogen again, and it's directly
Like a
influencing.
mini menopause, those 3 or 4 days, right? It's like
Exactly.
a mini menopause. Yeah.
Yeah, exactly. So it's a good kind of window into what's going to happen in the future. And then hopefully it motivates and gets people to take some action. And it's never too late. So there's people I work with who are post-menopause 15, 20 years who can make change. It's never too late. But if we can get this, if we can be aware and be addressing it along the way, then we won't need to experience dryness and atrophy and incontinence and all these things that can really interfere with our quality of life. So those are the most common. And then people who are potentially wearing pads because they have incontinence and because they're accepting it as, well, that's just the way that it is because that's what media tells me or that's what my doctors told me, then pads contribute to dryness as well. And so it becomes this vicious cycle that they're wearing pads to address the incontinence. It's not really addressing the incontinence, it's masking it, but that can also contribute to the dryness. And so again, people are just accepting that, well, I'm in menopause now and this is just the way that it is, but there is so much that can be done to overcome dryness and atrophy and get back to enjoying sex again, to not having clothes irritate us, to be able to move with more freedom. And so I hope anybody who's listening to this really has some hope brought back, because so many people are hopeless. They think that sex sucks. I can't have it anymore. My relationships are breaking down. I can't exercise this way anymore because I think I might make it worse, or because I leak all the time. And that's no way. Like we have to move away from that. And there's absolutely hope, and there's so much that can be done.
Another thing I vehemently oppose is bad sex. And of course, if you can, and I don't mean that in a, in a rude, or I mean it from a place of love. As a woman, if you are experiencing poor lubrication, pain, the penetrative sex is painful, and that you're in kind of that drop zone between the 40 to 53ish age range, then there's absolutely for you to understand what's happening, and
Yeah.
then to also understand that there are things that you can be doing to help with the integrity of the pelvic floor. And as you were saying, like, just to kind of reinforce this idea of right before the period, when we see this big drop, well, of course we know that the other thing that I've had women sort of confide to me is that the other time, if there is some sort of prolapse, is right before ovulation, where we see estrogen actually gets really high
Yeah.
right before ovulation. And that's because estrogen makes our ligaments lax. It makes our ligaments loosey goosey. So, and when we think about many of our organs in our pelvis are suspended in the abdominal cavity via ligamentous attachments.
Yeah.
So if you are, and this is all the more reason for my perimenopausal women to get their hormones under control, particularly those who run a bit more estrogen dominant relative to progesterone, because that is going to make your ligaments everywhere. I talk about it a lot in the context of like resistance training. This is when you should do HIIT. This is when you should not do HIIT. This is when you should lift
Yeah.
heavy. This is when you should not lift heavy. But it also applies here at in the pelvic floor as well, because your bladder is going to be a little bit more loosey goosey because those ligaments are loosey goosey. Uterus, same thing.
Yeah. I love how you talk about, and Dr. Stacey Sims talks about as well, cycling with our cycle. That's something
Yeah.
that I've always said is we go through these hormone fluctuations. So let's tailor our training so that we're honoring that cycle and the hormone fluctuations. And for people who are proactive minded, hyaluronic acid is a great it's a great vaginal moisturizer. So just like we put all this hyaluronic acid in our skin serums on our face, we can do the same thing with our pelvic floor, and that can help. Hyaluronic acid retains moisture, so it helps retain moisture, but it also helps heal any already dry, irritated tissue. There's I'm not financially tied to this, but moisturizeyourvagina.com has a great, very clean product that's hyaluronic acid and vitamin E that has transformed people's lives from a sex, but also just a daily comfort perspective. So I recommend people start that before they have a problem, but it's also something they can start if they already do have a problem. And also vaginal estrogen is something else that I think can be very,
Yeah.
very helpful for people. And sometimes even the postpartum population can benefit from that when they have the declining estrogen levels as well.
Absolutely. Did you say moisturizeyourvagina.com? Is that what it was?
Moisturizeyourvagina.com. Yeah.
All right. We'll get that in the show notes. And what a great name. What a great handle. And speaking of handles, I usually start off the podcast really understanding how the person's, body of work really came to be. And I was just so excited to talk about the pelvic floor. We just kind of dove in, but you are the vagina coach, right? Like that is the handle, that is your life's work. So I would love, first, do we all need a vagina coach? Like we all have like mindset coaches. We have, financial advisors, is it your opinion that we all need a vagina coach? And I would just love to know how that title came to be, because
Yeah.
it's wonderful.
Yes, I think every vagina will benefit from a coach. And how it came about was, so how I got into the world of pelvic health was through my own fear fascination with childbirth. And there was a biofeedback device made out of Germany called the Epino, which was designed to help prepare the perineum and the pelvic floor for birth. So I used this product, had a great experience, and my friends weren't having as great of an experience. And I contacted the company and I said, could I be a distributor for this and sell it on the side? That was my intention. So that's how it started. Gave birth to my second, started a website, started to get a few more different pelvic health products, learned about pelvic floor physio. So I hadn't until like a couple of years after my second was born, learned about pelvic floor physio, learned what they did, started screaming from the rooftops that every single person who has given birth should be seeing a pelvic floor physiotherapist, and as part of their postpartum recovery. And then I formed a second business called Bellies Inc. And we were looking at optimizing postpartum recovery. And we manufactured a wrap and coupled that with restorative exercise that was pelvic floor initiated. And so I was working very much in the birth world for a while. So it became kind of my full-time thing in 2009. And then pregnant women, new moms was the majority of who I was working with. And then as I was going through the different life stages, going into perimenopause, and people were coming to me saying, well, I gave birth 15 years ago. Can you help me? And the principles were the same. And I said, the conversation needs to happen through the life cycle. And at the time, with pregnant women, I was known as the fitness doula. That was my handle. And it didn't really resonate with people in perimenopause and menopause. And so I was kind of thinking, how can I change this? What can it be? So it was in my mind. And then I was speaking to, there's an organization in Toronto called the Mompreneur Organization, and they have a national conference, and I was one of the speakers. My talk was how optimizing your pelvic health can make you a better mompreneur. I get up on stage, and up to that point, as you were mentioning, there's financial coaches, there's marketing, people have coaches for all types of things within their business. And I got up on stage and I just sort of joked. I said, well, now you have a vagina coach for your business. And it just kind of came out, and it was like this light bulb moment. And I just said, that is it. It's the word nobody likes to say. It's the part of the body I want people to be focusing on. I want to normalize the conversation, and we have to get over this, vagina, like whispering this word. And so I just said, I put it on my Instagram, and I said, fitness doula vagina coach. And it like, everyone's like, hands down vagina coach. And I just said, all right, that's it. I'm committing, I'm making the move. And that was, I think, about 5 years ago now. And it was awesome. It is awesome. And sometimes people say, like, vagina, did you say vagina coach? And so people are still a little bit uncertain. Did she go there? Did she say that word? And
yeah.
But it sums it up. And I'm really truly on a mission to make this a word that is not so uncomfortable, and to make sure future generations are given information at an earlier age, and that we are proud, and that we rock pelvic health. It's not something we need to be ashamed of. And Kegels are cool. Kegels are a core exercise. And when we are doing them correctly and coordinated with movement, we are powerful, and we can have confidence through any stage of our life.
Absolutely. And you and I are on a similar mission, because I, wrote about menstrual cycles and talking about how we can understand and empower ourselves through the information that our body is always giving us. And the pelvic floor is absolutely no different. I think that, women have been taught, at least in the menstrual hormonal realm, we've been taught to fear our fertility, never actually taught how it works. I think the same is true for our pelvic. It's like, we know that the lady's going to tell you, your legs are going to be separated, and someone's going to say, push. That's like basically what everyone knows about their pelvic floor, and nothing else. And I agree with you. I think that it's high time for us to not have shame around our anatomy, for us to know what is a vagina, what is a vulva, the differences between the two. And I think, understanding how the pelvic floor works is such an empowering, piece of information as a woman to help self-regulate. I love it. I love what you're doing. It's great.
Thank you.
All right. So if people want to find out more about you, about your work, I know you have courses. I know you love hypopressives, as I do as well. I was stalking your Instagram handle and I was like, oh, she likes hypopressives just like me. That's so great. I use them almost every day. They're amazing. So tell everybody, courses, if they want to work with you, like how can people find you?
Vaginacoach.com is my website. And basically any of my social media handles are, if you put Vagina Coach into Google, you'll find me in Instagram and LinkedIn and YouTube, wherever you'd like to go. And I have two kind of components. So I have courses and programs for people that are pregnant or people who have incontinence and prolapse. There's a 28-day buff muff challenge. There's a 28-day birth like a boss challenge. So whatever phase of life you're in, there's something for you. But then I also have certification courses for fitness and allied health professionals who work with the female population and want to understand how they can, within their scope, not diagnose, but screen for things like incontinence and prolapse, and what sort of exercise can they be providing and movement and therapies can they provide to help their people move better and move in ways that actually helps rather than hinders their situation. So those are kind of the two components. And I also offer a free discovery call that people can book on my website. It's a 30-minute call with me because it's, not everybody is familiar yet with what a vagina coach does. And they're also like, okay, this person, I heard them and they're giving me a little bit of hope. What can my next steps be? And people can then come and explore, ask some questions, have a little bit of direction, and then decide whether working in one of my programs is right for them or working one-on-one with me. And a lot of people who learn hypopressives like to work one-on-one with me to kind of fine tune the technique. It's a little bit different than some of the other types of exercise, but it really is so powerful for prolapse and also incontinence. And I reverse the stage 2 prolapse myself with it. And I do it every single day. I love it. And it's a part of pretty much every person that I work with.
And you wrote a book as well.
I've wrote a couple books. My most recent one, Your Pelvic Floor, launched in March of this year. And I wrote one called Pregnancy Fitness that's published through Human Kinetics. Prepare to Push was my very first book. So that was, again, working with pregnant women and people. And I have another one called The Inside Story, which is more just kind of like a small ebook, but it talks about pelvic health through the life cycles. And all of those are also available on my website.
Amazing. So we will have all of those links in the show notes, Betty's, if you'd like to reach out to Kim. Kim, it's been a pleasure talking to you, and I will support you in all the ways that I can to help you get your message out there, one through this podcast with my Bettys that are listening here as well. So thank you so much for your brilliance and for your time. It's been great.
Likewise, I really enjoyed chatting, and thank you so much for helping increase awareness and get the message out.
You are welcome. Dr. Stephen Gundry is the video that's coming up next for you. Just click right here. We're talking about the microbiome, energy, postbiotics, mitochondria, and how to get your energy back.
Continuous ketosis, 24 hours, 7 days a week, 365 days a year is really dumb.